I've always sat in the church pew and wished that I could do more in the church as a nurse, and never quite found my niche until we started doing the parish nursing.
This is a real high for me in terms of getting to apply all the things that I love, getting to know people and be able to meet their needs totally, watching them grow spiritually, but also watching them learn to take more responsibility for themselves and become increased in their wholeness.
We have the privilege of having Evelinda Camacho. She's our one of our members. She's a registered nurse. She's a very an excellent teacher. So she's been doing several things like giving clinics for blood pressure, early detection of high blood pressure, early detection of diabetes, also giving conferences and lectures on problems that affect the general population and especially Hispanics.
Well, the community has responded much better than I thought that when we started, because coming from a Spanish background, sometimes we think that faith alone doesn't mix with anything about related medicine, medical field, but they have accepted the program tremendously.
I have helped educate, refer, pray with people. Our Wholeness and Healing service has been a very powerful experience for me as I participated with people and praying with them and for them.
There are a lot of times when parishioners come to me to ask me questions about, what are their options as far as putting their mother in a nursing home, or they're facing a serious surgery and they don't know if they're doing the right thing. So I spend a lot of time talking to individuals about, some things that they can think about to get through that process.
I did have one lady who came in and had decided that nothing was helping her and she was going to go off of everything and wanted to know what I thought about that. And so we talked for a long time about each medication she was on and why she was taking it and how she might approach her doctor with her concerns and see what he thought about reducing the amount of medication that she was on. She found this to be helpful.
I would tell a nurse considering being a parish nurse that this isn't just a job. You're just not a nurse in a church. It's a ministry, and it's a chance for you to collaborate with a pastor, the church staff, and the congregation to really insert your faith into a ministry of healing and wellness.
And let me tell you, if I can recollect my whole experience as a nurse from the beginning, I do believe that the Lord has guided me to different pathways in the medical field so I can acquire the experience that I needed to perform the parish nursing ministry right now.
For me, this is just a very good fit, and I feel that God has been preparing me for this for many, many years. I'm very grateful to be in this area and be able to work in this way.
I think this is a terrific program, and I would love to see it grow in every congregation. I think a nurse has a very special role within a congregation. People will tell a nurse sometimes things they wouldn't tell other people or even their own pastor. And there's a whole journey to wholeness that the congregation can take together to support one another to grow toward health and wholeness.
I think that if I was commissioning or recommissioning my parish nurse, I think I would say to her, go forth and be a health promoter.